Good morning, everyone. Welcome to the second in our series of Mental Health Matters programs. I'm Tara Phillipson, and I serve on the Peace River Center Advisory Board. I want to welcome you on behalf of Peace River Center and our partner, Polk Vision. And Kim Long and Tara Watson from Polk Vision have been very actively involved with us on this, as well as Alice Newton. We'd also like to thank Florida Blue and Sunshine Health for their sponsorship of these programs, and Dr. Sally Stone and her husband, Matt, who are the owners of this facility, for their help with getting everything. Peace River, as a community behavioral health organization, desires to educate the community on mental health and help reduce the stigma regarding this topic. We had this in-person seminar today, as well as on Zoom, and there will be a recording of each of the 3 seminars available later on the Peace River website. Our third program and last one will be on May 24th, and will be on mental health in the workplace. We chose topics for these 3 seminars based on a recently completed study by Polk Vision on behavioral health and on its recommendation. And one of them was community awareness. Our format today will be 45 minutes for our panel, and then questions, 5 to 10 minutes at the end. We want to thank all of our panelists for taking the time today to share their expertise on this topic. And this is a grant-funded program, and so there are sign-up sheets at each table, and we would ask that you pass those around, sign up at the back. Some logistics for today: there are refreshments at the back, and there are restrooms right on the side. Mario, standing by. Our panel is, well, let me first introduce Alice Newton, who is Associate Vice President of Behavioral Health Services at Lakeland Health. And she'll introduce our first speaker, and then I'll come back and introduce the panel. Thank you.
Thank you, Carol. I appreciate that warm welcome. And thank you to all of you. It's wonderful to see your faces here in present form. We are still really celebrating the fact that we are getting to gather. Our mission at Polk Vision is to pull together the community to have these crucial conversations. And this is one of them about mental health. So you are a part of that, as well as our guests and our people that are virtual. Thank you so much on behalf of the executive board and the behavioral health team at Polk Vision. It's also my true joy and delight to be able to introduce Tara Auclair to you. Tara is known and loved to us because of her work with the Crescendo group that was really incredibly instrumental in creating that study that Carol just mentioned at Polk Vision. We really launched into a tremendous undertaking during the pandemic, an 11-month process of engaging lots of different factors of the community, and Tara was instrumental in that. She is the director at Crescendo Consulting Group and brings deep experience in the healthcare industry and with other mission-driven organizations. She's held various roles in organizations, including health IT, startups, hospitals, nonprofit, and more. She's a process-oriented strategic thinker, and she enjoys working with people and individuals and organizations to ensure the best possible outcomes for all stakeholders. And I can personally attest that she puts her heart into her work, and when she listens, she really listens with her whole self. Tara earned her BA from Tulane University and her MBA from Boston University. She serves as the co-chair of the board of directors of the Alzheimer's Association of Southeast Florida. And she chairs the longest day and the advocates at the state and national levels for the Alzheimer's Association. And again, her passion for that work is so influential in her work here around the concepts of mental health and behavioral wellness. She's a longtime member of the Junior League, where she's held numerous leadership roles and received the Outstanding Service Award in 2019. So Tara, thank you so much for welcoming the panel and being here to facilitate. I think Carol is going to share a little bit more about our wonderful individuals up here on the panel, and I look forward to a dynamic conversation.
Gwinnell Brant, our moderator, MPA, CPM, and is a seasoned civilian law enforcement professional with a career at the Polk County Sheriff's Office spanning 3 decades. She currently serves as the Director of Mental Health Services, created in early 2022. She is tasked with assessing and enhancing mental health related processes within the agency to ensure that best practices are employed. Serves as a liaison to external behavioral health stakeholders, fostering collaborative efforts to best serve the citizens of Polk County. Prior to this assignment, Gwinnell served professional compliance for 9 years, leading agency strategic planning and accreditation processes for the 2,000+ member agency. Currently, Gwinnell is completing her dissertation toward a doctorate of strategic leadership from Liberty University. She received her Master of Public Administration from Troy University and her Bachelor of Arts degree in Organizational Management from Warner University. Gwinnell is actively involved in the Polk Vision processes, currently serving on the government and behavioral health teams. She is a graduate of Leadership Polk Class 9 and Leadership Lakeland Class 37. She is also an active member of the Lakeland Rotary Club, having served on the board of directors and as communications chair. Gwinnell.
Thank you, Carol. I appreciate that introduction. It's still hard for me to believe when I hear my introduction that I have a 30-year career at the agency, and I have to remind myself that back then we hired 2-year-olds. So I'm excited to be here today to share with the subject matter experts that we have. I'd like to bring Tara up and ask her to launch this panel discussion with some information that she gleaned from our study and also about trauma. So, Tara.
Thanks so much, Gwinnell, and thank you, Alice, for the introduction. I really appreciate it. As you heard, my name is Tara Auclair. I work for Crescendo Consulting Group, and as a native Floridian, I am just so impressed by all the work that's been done here in Polk County. So I was asked to give a brief introduction to the topic today, which is the pandemic and trauma. So let me start before even the pandemic, because this work has been going on for years. The original point of the entire presentation and the report that we did before was really to improve the quality of life of Polk residents by addressing behavioral health needs. Right? And this did not start with this project that Crescendo was involved in. It really started out back in 2020. The community health assessment was done, and behavioral health and substance misuse was named as the #1 need. So then we came in and we just used the information that came before us to really create the behavioral health assessment and strategic plan, right? And it was 3 distinct stages. I'll be going over each of these in a little bit more detail. The first stage was really to figure out what do we have, what is in the community, right? We have to start with knowing what we have before we decide what needs to be done. So this was a very detailed process to create a map of all the different resources in the county and what they offered. And not only that, but what were their hours? Who did they serve? And we talked to a number of different individuals all over the county from a number of different divisions. But we also looked at maps. We did tons of research to come up with 100 pages, right? So this is all available for you. And it was done in a way so that it could be updated as needed, right? It's just a snapshot in time, but things change over time. Right? So we want to make sure that this is a project that can be updated and kept up with the needs current landscape of the community. Next was a gap analysis, right? So what's going on and what's missing? What's doing right and what should we keep on doing? And then, so what else? What I have to say, we work with clients all over the country, all over. And the engagement in this room and this county was off the charts. I mean, sometimes we need to pull teeth to get people to talk to us, believe it or not. But here, everyone was clamoring. Everyone wanted to share. Everyone wanted to say the good work that they're doing, and then the work that needed to be done. So we talked to, and you can see this up here, like over 80 interviews, 14 group discussions. And one of the things that was so impressive, we did a survey of jail inmates, thanks to the collaboration with the sheriff's office. That doesn't happen. That just doesn't happen. So we really had a very broad view of the community during this research process. And it just was extremely impressive. So what did we find out from this research? Right? So there were really 4 different objectives that were distinct, but there's obviously some fuzziness along the way. But first, we had to build capacity and increase access to care. Right? And access means a lot of things. It's not just how do you actually get there, but how do you pay for it? What do you have the insurance issue, et cetera. Secondly, increase services for higher risk groups. That could be jail inmates. It could be LGBTQ plus community. It could be Blacks or African Americans. There's a number of different individuals that can fall into that category. Then reducing the stigma. Right? We all have mental health issues, and I think that's pretty clear after the pandemic and during the pandemic, right? We all have anxiety. But really, how do we make that okay to talk about? Not just in the community, but in the workplaces, et cetera. But we can't do all that without first breaking down the silos, right? We can't have different organizations doing different things and not talking to one another. That just will not work. So how do we do that? And that's something that, again, impresses me about this group and has all along the way. So the final stage was developing a plan, right? How are we going to do this? There's a lot of need, so now what? So we had a list of 41 different prioritized needs that, and not everyone can do everything. You have to look at what's most important out there. So how do we do that? We did a matrix exercise, essentially, looking at 4 different factors to see what's most reasonable, right? What's the priority? What can be done individually versus what needed to be done collaboratively? Who controls this? Right? Because control is a big thing. Like, where does this live? Is it done in one organization, or is it something that can be kind of managed cooperatively with a number of different organizations? And then, what's the priority and timeline? Right? How do we really look at all these to make sure that they all get done in the right order? And this is not something that one organization can do. It's not something that 2 organizations can do. So this really was a community assessment to share. And I think that's a perfect example of what we're doing here today. We're sharing this information. And then we looked at a number of different programs, like what works around the country that may be applicable for Polk County. Like, there's some really great best practices out there, and I should add you all to that list. But what are some of these best practices and what can be done? So to do that, then we determined there were really 5 core strategies. Expand crisis services, mobile health care, and centralized care coordination. This is both for youth and adults, right? This is very important. We need to just go to where people are. Mobile health services, especially in such rural areas as Polk County. It's important to go where people are, not just create a hub and expect everyone to come there. It's transportation stuff. Create a coalition, or have that assigned somewhere else. To really, because it needs to be managed. It needs to be managed and have it be thoughtful. And so that needs to live somewhere. So where is that? Expand the capacity. In our research determined that and Polk County is not unique with this, but we need more resources here. More doctors, more nurses, more therapists, more volunteers that can help people through the system. Expand criminal justice services. They do a fabulous job, but more is needed. And we have a wonderful partner with the Sheriff's Office. And engage diverse community groups, right? Because different communities learn differently, they react differently, and this can't be done in a silo. So that brings us to now. The pandemic has been still here, right? We're still seeing the numbers increase. I live in Miami, we're definitely seeing that there. But for me, I'm not a clinician, I'm not a doctor, I'm not a therapist. So for me, it's like, okay, I'm talking about trauma in the pandemic. What really is trauma? So I really wanted to look at that. And our panelists will be talking more about that. These are the experts here. For my purposes, and just to set the stage, it's emotional response to a really bad event. And it could be something horrific, like what we're seeing in different wars around the world. It could be a rape, it could be something else. But trauma is a very broad term. And I think that, as you see, the pandemic could definitely be included in that. And the feelings of the pandemic and the effects of it, of trauma, don't stop once it's over. They continue for lifetimes, and it affects generations. And a big part of our research, we learned pretty much from everyone that we spoke with here, is the importance of engaging with the children at the point that they need it. Right? And the sooner we do that, the better. So we looked at ACEs, or adverse childhood experiences. And on the screen, you'll see some ACEs. This is by no means a complete list, but everything that a child experiences will affect them for generations and for their life. It can affect their education, job opportunities. ACEs could be defined as violence, abuse, or neglect, or witnessing it even. Having a family member attempt suicide or die by suicide. It could be substance misuse, it could be mental health. And then just anxiety, or what happens when the parent goes to jail or to prison. And again, these are long lasting, and this is not the only list of things that could occur. But we're going to go into each of these in a little more detail, because this will set the stage for later. There we go. And thanks to the Sheriff's Office for providing this, but this is statistics for violence. So you'll see between 2000 and 2001, the numbers are steadily decreasing. In fact, they decreased by about 8%, a little under 8%. Then once the pandemic started, between 2020 and 2021, the numbers increased by over 15%. And this is only in Polk County, which is why I think the slide is so poignant, because this is here, right? This is not national statistics. This is what's going on right here. Suicide. Suicide actually dipped a little bit during the pandemic, the first year or so. Statistics showed, but then numbers started to inch up again. 13.6 per 100,000 Floridians committed suicide in the first half of 2021. That's Florida. Right? That I found this morning. So I updated my slide this morning. I want to make sure I had the latest, but that's a pretty vital number. It's a leading cause of death here in Polk County, and it's higher than the state average. I'm not going to read all the statistics, but you can read these at your leisure. But the numbers are real. These are not just numbers, they're people. These are families that are affected by this. Substance use. It's a problem, right? I think, again, I'm not going to read all the statistics, but numbers are increasing. Whether that's opioids or illegal drugs that are used incorrectly, whether it's illegal drugs that are used at all, it could be smoking, it could be vaping. The numbers are going up. And that's both for children and for adults. Mental health. I think we've all suffered. At least I can say I have, and I'm very proud to admit that. Not proud, but I'm willing to admit that. This pandemic has been tough. Mental health needs are increasing. In fact, poor mental health was higher in Polk County. Poor mental health days are higher in Polk County than they were in the state. The numbers are pretty staggering. Almost half of adults struggle with anxiety, more than that for children and for women. And then the effects of someone, parents, especially going to jail. I mean, that's tough for children, that's tough on their families. There's that instability, it's emotional trauma. Where I know we're going to be talking a little bit more about that, not just today, but going forward. But what are the effects of the jail population and their children? How does that affect everything? But it's not all gloom and doom, right? But we're setting the stage, right? This is very hopeful that we're even here today. There's huge opportunity, and time for intervention is now. And I think that's exactly what we're doing here today, and what we will do every day. Right? So how do we do that? We break down silos. And we talked about that earlier, and we talk about that on a regular basis. Things can't happen in their own little lanes. Substance misuse and mental health are not mutually exclusive. So how do we create those conversations that really will make change? And it's not doing the same thing in the same way and expecting something different to happen, right? It's making change. And it's by engaging different people, different communities. It's reaching out. It's going to community leaders, whether it's through your church, whether it's through barbershops. And there's so many different models out there. And how do we do that? It's by being intentional. That's one thing that we're doing here today. Looking at the data, creating partnerships, thinking outside that box, the proverbial box. And it's easy to look at a problem and know that that's huge, but I think just by the fact that we're having these conversations, we're changing lives, and every life matters. That's all I have. If anyone has any questions, please let me know. And the reports are available. I'm sure the team at Polk Vision is happy to share those if you haven't seen them already. But there's all this, most of the statistics that I included here are from that study. When they weren't, they were noted, but really, these are open to the public. This is how we change things. Thank you.
Thank you, Tara. And I think to echo that, and Kim can probably confirm in the back that the study is actually available on Polk Vision's website, polkvision.org, I believe. And so .com. So you can go to that website and get that study yourself. It's got some great information. And I'd like to echo what Tara said. I think if there is ever a time for change and to exact change in ever a place, it's Polk County, and it's now. We have such collaboration. My new position, probably this is my third week in this new position that the sheriff created as the director of mental health services. And Sheriff Judd has wanted to be on the leading front of this and partnering as we move forward, understanding the betterment of our community is what we're trying to get to. I'm excited about this. So even though I've been in my new role for 3 weeks, for the last year and a half, I was appointed to work with the behavioral health team as Crescendo did their study. And it's opened my eyes up to a lot of things, but it's also made me very proud of Polk County. As I was preparing my thoughts for today, I thought about the story of the 3 bricklayers, and I think we've probably all heard it, but a passerby was walking by a construction site and there were 3 bricklayers there. And he asked the question, "What are you doing?" And the first one said, "I'm laying bricks." And the second one said, "Well, I'm building a wall." And the third one said, "I'm building a cathedral." And while all of those were correct, the third one had the vision and understood the value of their contribution to what they were doing, that they were building a beautiful cathedral that many people for years to come would worship in and be able to admire their handiwork. So I challenge you today as we go through this panel discussion is to ask yourself, am I just here because I'm checking the box? Somebody asked me to be here. And that's not a bad thing. That's great. We're glad that you're here, and to our online community saying, are you here because it's a great opportunity to network in the community and with your other behavioral health stakeholders? That's a great thing too. But what I want you to take with you today is that you are a part of transforming lives in the county. You're not just here just simply to attend a panel discussion. And what you do with the knowledge that you have and the action that you put forward is going to help us change this county. So our vision and our perspective will determine our success. So thank you for being here. I want to remind everyone, and especially those online, that we are going to be opening up for Q&A. You can text questions to 863-888-2911, and I'll try to remind you all through the panel discussion as well. I'm excited to be able to introduce our panel of subject matter experts. I am not, like with Tara, I am not a clinician. I'm not a behavioral health provider, although I'm a behavioral health stakeholder. And I have great respect and admiration for the work that they do. I'll start out introducing Kirk Fashauer with Peace River Center. Kirk is the Director of Crisis Response Services for Peace River Center, and he's been with them for 22 years. And he was responsible for creating the crisis response team. He has a cumulative of over 30 years experience in mental health and psychiatric emergency health care. He holds a master's degree in social work from Rutgers University and a bachelor degree in psychology. He's a licensed clinical social worker in Florida, and he's also a trained crisis hostage negotiator and a certified field traumatologist. And I can speak from personal experience that I have been working with Polk Fashauer. I knew of him, but I've been working with him for the last year and a half, and he was on the frontier of partnering with law enforcement over a decade ago, understanding the importance of that partnership and not just serving our community, but serving our patrol and the members of our own agency. And he is a valuable asset to us, and I appreciate the opportunity to work with him. Nicole Sweat is from Lakeland Regional Health, and she's currently the behavioral health program manager there. She has worked at LRH in the behavioral health department for 20 years. They hire 2-year-olds too. She knows the full spectrum of programs that are offered there. She oversees all the therapists, the social workers, the legal processes of Baker Act Court, as well as recreational and therapeutic groups. Nicole is a fierce behavioral health advocate, and I have heard that consistently in this community. She's been in the Lakeland area for over 2 decades, and she sits on multiple boards. She serves our community in multiple ways. She sits on the Baker Act Marchman Act Advisory Group for Circuit 10, as well as the FACT Team Advisory Group. And she's been integral in placing and creating the foundation for multiple projects, such as Helping Hands. That is a great program in our jails. NAMI, as well as the practice of using peer specialists in the hospital setting. Nicole is a known expert in mental health law for children, adults, and senior adults, and she's a transformational and inspirational leader, and her joy for what she does is contagious and very apparent. Last but definitely not least is Alicia Wilkinson, and I have had a good time getting to know her a little bit better, and she too exudes the joy and has a passion for the work that she does. She is a licensed clinical social worker, and she's diligent in her field and compassionate, committed to the profession. She started her journey in 2011 with a passion to help advance the well-being of those she serves. Her mission is to successfully empower individuals and families by providing information and skills that they need to thrive and maintain healthy relationships. She's currently employed through Napier, where she works as a licensed clinician contracted through the Polk County School Board, helping students reach their social and emotional goals. And we know that that helps them achieve their academic goals and prepares them to be productive citizens in our community. So we're excited to be able to welcome our panel of experts, and we'll just go ahead and launch it off. I know Tara did a great job laying the foundation for where we are in Polk County and trauma. So Kirk, I'm going to ask you to start and share with you what your experience is on trauma, how the types of trauma, how that affects our communities, specifically here in Polk County, and then I'll have Alicia follow up and talk specifically about our children.
Okay, well, trauma has many forms, very complex. We usually narrow it down to a few categories, complex and cumulative, and vicarious, developmental. We can go on and on. There's a whole bunch there. We will get into each category and explain a little bit about each. Some of the work that I've done as a field traumatologist, I've been able to travel the world a little bit with regard to seeing trauma in various cultures. And it's a consistent theme of how it impacts one's development, one's view of the world, and being able to provide that assistance for individuals going through tough times, whether it be natural disaster or man-made. And often man-made disasters are far worse. And that makes sense because we look at each other and go, how dare you? We're all struggling through the human condition together, and then you make it a little bit more difficult to be by terrorist act or intentional act that goes to harm somebody else. And that's unfortunate. So it tends to be a little bit more deeply rooted, deep-seated. So if I were to put it into one word, well, that'd be a difficult task to do is what trauma is. First word that came to mind was horrific, and another word would be debilitating. And some of us who suffer trauma still function is debilitating in other ways that isn't obvious. It slows us down moving forward with our careers, it slows us down moving forward in relationships, and that may not seem as overt and obvious. Speak louder, I'm sorry. Okay. So when it comes to encountering an event that's traumatic for me or somebody else, one of the key things to making it traumatic is one's perceptions and one's support systems and what they have in place before the event even happened. It's one of the few mental illnesses, post-traumatic stress disorder, where there needs to be an actual event or series of events. Our minds like to go to that cause and effect kind of process. We want to know why. For a lot of things, we don't have that answer. So with this particular ailment, yes, we can say this event or these series of events have led to this condition. One of those few areas, and then it enables us as practitioners to start to target the unfolding of the emotional impact. Because people go into therapy with this impression that we're going to take it all away. And one of the things I tell folks that I work with is, I can't take the event away. The event happened. I don't have a time machine. I know I skipped a few classes, maybe they handed out the time machine back then, but I missed out on that. But we don't have a time machine. The event is the event. It happened. What I can do is soften the blow, soften the impact of your emotions around that particular event. Because we need to grow and process further. So I'm going to run down the line here.
Thank you. As you stated earlier, there's different types of trauma. Well, it's important to focus on the different ranges as well. There's 3 different main types of ranges of trauma. We have acute trauma, and that could be an emotional response, like during or of a single distressing event. For our children, that can look like a car accident or a school shooting. Then we have chronic trauma, which is a long-term emotional response a person can experience over repeating distressing events. And for children, that can look like domestic violence or abuse. And then we have also our complex trauma, which is the emotional response associated with different distress. And sometimes that can overlap. That's more like of our sexual abuse. And then for children, that can also look like taking on adult roles a little too early in their development. So it's important to realize that during their developmental stages, this is important for children because it's like they're constantly living in a state of heightened distress. So think about how hard that is to take on all the responsibilities as a young child during those developmental stages, and then also trying to grow into a productive citizen. More than 2/3 of our children will report at least one traumatic event by age 16. So if we let that sink in, like how many children do we encounter each day that's experiencing a traumatic event?
Thank you both for sharing your insight on that. Recent data indicates that there's an increase in the prevalence of mental health conditions and an increase in the severity of those in crisis. Can you share what you've witnessed in your own practice and your perspective, and maybe what the most common symptoms are that are presenting themselves in individuals? Nicole?
Yes, so at Lakeland Regional, obviously we had a ton of increase of COVID patients in our medical unit. However, we noticed an increase in our behavioral health unit with an increase of stress, anxiety. We had a lot of grief. There's been a lot of loss of life that happened during the pandemic. So we had treatment with stress, depression, anxiety, decreased sleep, and there's a wide range of symptoms associated with that. We also had an increase of substance use patients coming in. So there was a combination of both mental health and substance abuse. We saw patients coming in reporting that they lost a job or that they were stressed out because they were trying to homeschool and work. So we definitely saw an increase of those COVID-related symptoms.
Working in the school system, of course, each child presents with different symptoms. But for our preschool children that look more like fear of being separated from their parent or caregiver, over the past 2 years, they've been working with their parents only each and every day. It was a lot of crying and screaming, eating poorly or a loss of weight, and then having nightmares of having to socialize, and they just weren't used to it. For our elementary school children, that was becoming anxious and fearful, full of guilt or shame, having a hard time concentrating and having difficulty sleeping. And then for some of our older students, such as middle school and high school, those symptoms presented as fear of depression and feeling of being alone, developing eating disorders and self-harming behaviors, also beginning using of alcohol and drugs. Also, vaping has been recently increased, and then becoming involved in risky sexual behaviors.
Thank you both. Kirk, can you wrap that up?
Sure. So in the early days of the pandemic, it was you see an increase. And at first, we saw, with our crisis team, we saw just a slight decrease in services. That lasted 3 weeks. After that, it bounced right back up, bounced pretty hot, because a lot of it was COVID related at the time in the beginning. I'm worried I'm going to get it. I'm worried about going out and seeing people, and that anxiety has maintained itself. And we have seen increases in issues around being anxious about being around people, even to this day, as we slowly are hopefully coming to the light at the end of the tunnel with this particular thing, and it's becoming endemic, pandemic. What we're hoping in this phase of it's a disaster, in this disaster phase, and we're at the tail end of it, and we're starting to really challenge some of the services and some of the things that we provided through the pandemic are going to be even more taxed at this point in time. So when things are building up in the early days, it's going to continue for a long time for a lot of us. So we're seeing uncertainty. Is it? We watch the news on a regular basis. That's going to be anxiety provoking no matter what, irregardless of what's going on in other parts of the world. But you hear the mask up, don't mask up, get a booster, don't get a booster. It's dying down. Oh, it's building up again. We got another variant. Oh, it's like, oh my goodness. You know what? Trauma is that house guest that shows up on your doorstep and invites itself in and never leaves. And then wants you to entertain you. It wants you to entertain it while it's there. Oh my God, there's a lot of things going on. You see job loss, fear of that. Talking about loss on the grand scale. Definitely the loss of lives that have been out there. Some of us have been impacted by that. The loss of functionality. Some of the folks that I know that have been stricken with this illness are having to readjust because of their medical conditions have changed for them. We've got schools that partner with our schools here in this community to work with kids and families. Now we're getting ready to go back, and what we're seeing is an increase in separation anxiety, because for almost 2 years, kids and parents were together, and they're in it together, and they're homeschooling for a lot of people. And now we're saying, let's get them back into school, let's get them more socialized. And the anxiety for the kids go up. Why? Because they're seeing their parents' anxiety go up, because we're afraid to be in close contact with one another, and we're throwing them into a whole group of other kids. And we know kids are good for sharing the illnesses, right? Anybody who's raised one knows that daycare comes along, and you get every disease out there. It's a cold, a sniffle, you're going to get it. Stomach virus, things like that. But in the same vein as we're trying to get back to a different normal, getting back out there to socialize, what we are coming across too is that isolation is also causing anxiety, and it's causing depression, and it's highlighting some issues that maybe weren't prominent before the pandemic, but as people start to isolate, they become much more magnified. Because when you're alone, you're there by yourself, looking at the mirror lots of times, you know. We see more acting out aggressively because of the fear, because of the frustration that is taking place as a result. So a lot of the calls we get on the crisis line shifted dramatically. We used to get a lot of information for all kinds of calls. Hey, can you help me get connected to that service? Which is great. That's one of the things we provide. But we noticed a major increase in calls about anxiety, calls about depression, calls about medication. Am I going psychotic? Those kinds of questions. Because when we start to isolate, we lower our frame of reference to one another and say, hey, is this kind of normal? I'm not really sure. I check you out and say, okay, I'm all right. Everyone else is doing this. That's good. And when it feels odd, it's, am I that outlier? So people struggling with questions of the future, questions of how do I do my job differently? And we've also been exposed to how to do some things differently. That was in the beginning, kind of maybe, and it got pushed there. You know, that hybrid form of work for all of us, because even the work we did, telehealth. Wow, you know, we're all dancing around it. Yeah, we'll try it out. And then this pandemic came, and telehealth, pros and cons with it. In ways, has opened up a really new venue for reaching out to people, especially in our rural communities.
Thank you, Kirk. We talk about how mental health and behavioral health issues are a complex problem already. It's a wicked complex problem with so many different things going on and that need to be addressed. And, you know, Kirk hit on that when the pandemic hit, it just complicated things even more. So, Nicole, if you could talk to us about the pandemic, and do you consider that a prolonged trauma? And what could be the long-term effects we're seeing? I think we see the familiarity and how you all have described what's happening, but what can we expect long-term?
Yeah, so COVID-19 has led to a diverse mental health problems, as we all kind of touched on a little bit. And, you know, 2 years is a long time. Just think about if you have one traumatic event and that time frame is horrible. So now we're doing 2 years. So in 2 years, people have increased anxiety, depression. If you don't get that treated, if you don't handle those symptoms in a positive way, you know, get some education or support for that, some of those behaviors and feelings and thoughts will continue. So this will just keep going on with the person. So for example, if maybe they're, you know, have a new job layout or a different way to do the job is more stressful, but they're just keep doing that because it's the way we have to do it for the pandemic, and then that's the way it's going to be. That continued stress, that continued anxiety will just keep going on, you know, without treatment. So it's the feelings, the thoughts, the symptoms we're having now with a traumatic events through the COVID is just going to continue if there's no help, if there's no support, if there's no awareness.
Can you add to that?
Yeah, I agree. This is a prolonged event. Disasters have pretty much 8 phases. Yeah, I keep referring to it as a disaster. It's very disastrous, especially for some of us who have been hit harder than others. And in the beginning, yes, we had news stories about how heroic neighborhoods were and people singing off balconies to one another and fun things like that. Well, that's that whole uplift of, hey, we're doing lots of things that can only maintain for so long. And now we're into sort of we're not quite into the recovery phase yet. We're still kind of teetering on the edge of still being heavy into it and getting into recovery. We get glimpses of recovery, and then it gets pulled back from us. And that adds to the frustration as we go through it, because the outcomes are unknown and it's ever evolving, it's changing. Information is fluid. And that's the good and bad of having access to information 24/7. Because you get information right away, which is good, but it's not always good information. It could be, oh, we got a little grain of hope here, and then the next story is not so much hope as we thought, and then back and forth, and that creates a whole bunch of anxiety and frustration, where does it come out? Comes out in ways that can lead to additional problems, and we lash out at those that we're closest to usually. Now, is this creating a whole new layer of issues? Yeah, there's a new layer of issues. For folks with pre-existing conditions, it has just magnified that. Substance abuse, of mental illness, and gaining access to those services, how to take care of yourself through this process. Because the loved ones that you're isolated with, they are suffering just as much as you are, trying to help you and being scared about accessing.
We recently held a session. The first panel was on youth and children in Christy's here. She shared a lot of her insight as well. So Alicia, can you share what your experience has been in treating youth during the pandemic?
Yes, during the pandemic, as adults, we were faced with a sense of heightened anxiety and fears. So inadvertently, that was passed on to our children. I say our children because it takes a whole village, right? So watching the news and talking with friends and family and taking on the added precautions, our children were noticing all of that. So of course they were facing those similar fears. Working with the kids, they were focused on a lot of death. They were asking questions, you know, is grandma gonna die? What is that gonna look like? From some of our younger students, we got a lot of questions like about heaven. And I was surprised because, you know, those were some of the conversations they were wanting to have. Like, is grandma gonna go to heaven? Will I see grandma again? So these questions students were presented that we didn't see prior to the pandemic. There was a lot of concentration on death and afterlife. Then surprisingly, you know, a lot of our students with individualized education plans, they didn't mind missing school, so they didn't mind not having the face-to-face interactions. But of course, that was the area that they were struggling with. So having that gap of 2 years settled back. So it was difficult for them. And then now, after the pandemic or coming out of the pandemic, a lot of our students have those ongoing jokes, right? Coronavirus or you know, caught the Rona. And then they're kind of using the COVID excuse to miss school days. So it's an ongoing struggle with our students during and after the pandemic.
Alicia, I've got a follow-up question on that. Parents obviously were affected and the children have seen that. What advice could you give to parents on how they can reassure their children or not pass that anxiety on to the children?
Modeling is a big help for our kids. What we see our parents do, of course, they're gonna naturally carry on. So modeling good practices, taking those added precautions, but letting them know, hey, it's okay, we're gonna make it through this. Letting them know it's okay to talk about those anxieties and fears, even the loss of jobs and that added stress. Letting them know, hey, this is a part of life, and then showing that resilience to our kids and teaching them that, yes, this is going to happen. Yes, traumatic things are going to pop up in your life, but we will make it through it together.
Thank you for sharing that great advice. We're going to shift a little bit and talk about substance use during the pandemic. According to the CDC, as of June 2020, 13% of Americans reported starting or increasing substance use as a way of coping during the pandemic. Overdoses around the nation have increased. So I'd like to ask the panelists, we can start with Nicole. Have you seen that in our local community, and what treatments or medications or services are available for those suffering from those issues?
Yeah, so we definitely saw the possible increase of admissions, both directed and voluntary patients coming in with suicide attempts, suicidal ideations, just the increase of all of the stress and depression, all of the factors that you have spoke about. So we definitely saw a large amount of our patients coming in with those concerns. What we've done at Lakeland Regional is obviously continue to stabilize the crisis, provide resources, support, medication if needed, of course, follow-up appointments. For the substance use, what we have really seen a huge impact is our partnership with Tri-County with having their peer specialists there. The peer specialists are able to reach patients on a different level. They've experienced what they've experienced, so they can really get to them and see the root of the problem and be able to provide the support and encouragement and get them connected to services to leave the hospital. So once the patient is stabilized, either detoxed or over the crisis that led them to the hospitalization, the peer specialist can get them into a program, either outpatient, inpatient, or whatever is needed. Just in April alone, the peer specialists were able to help over 150 patients. So that's a lot of people. That's just not in our own behavioral health unit, that's in the whole hospital. So they're really able to, help people with substance use since it has increased. There's also, MAP programs out there that we refer to. At Lakeland Regional, we also provide Narcan to patients that are discharged from the behavioral health unit or the emergency room, and give instructions on that, how to the family so that they can be able to, provide that medication and need. And we've also increased our telehealth appointments too, because we know that patients, individuals are not able to go out to their appointments like they should, and we don't want to cut that service off. So we opened up to be able to provide services at home for them.
Alicia, I know you mentioned vaping being something that you were seeing more common now. Can you address that as far as the substance use and what you're seeing in our youth in the schools?
So in the school system, of course, from Monday through Friday, we have that extra. Okay, sorry about that. We have that extra layer of protection. So sometimes our students weren't able to have mom and dad home constantly watching them. They had to work, of course, to be able to continue to provide. So during the pandemic for 2 years, sometimes we had students home alone, and maybe they experimented a little, and maybe they wanted to have those cool factors that their friends are passing on to them. So they did increase the experimental. Social media played a big factor in it. Our students were home all day with nothing to do other than create challenges. So one of the challenges that went around during the pandemic was the vaping. And so, of course, that naturally spread it kind of quickly. And so our students were passing that on to each other. So that may have played a part in the increase. And then also parents was increased in substance use. So if you see mom and dad using extra that added substance use, it's around the house. So maybe they picked it up that way as well.
It's a perfect example of the modeling you spoke of earlier. So if I, as an individual or a loved one or a friend or coworker, I suspect is having issues, substance use, what are the signs that we should look for, and at what point should we encourage them to seek professional?
Okay, well, of course, you want to be able to talk to somebody that can look different. You can call the crisis line. Of course, you can talk to a friend, a guidance counselor, a teacher, just being able to talk to somebody. So, at Lakeland Regional, we are starting a program with Shop Talk. So, how when I was referring to the barbershop, so we were able to partner with some community service or community programs and facilities and locations to be able to reach out and be able to talk to people. So it's okay to be able to talk to your barber. They'll have resources and services for you, or different community members. Also, there's a lot of different programs now, like Be the One to be able to talk to somebody and reach out to them, and just that knowing it's okay not to be okay, as all of us have been talking about the symptoms of the COVID. I mean, I don't think COVID has left anybody alone, so we're all affected. So knowing that it's okay not to be okay and be able to speak to somebody. There's a lot of support with NAMI, of course, for family members to be able to have some additional support resources for the loved ones who maybe have more symptoms than others. And of course, you don't want to isolate. Now more and more people are, being able to get out and do more things. So we definitely want to encourage that. But just being a friend there for anybody, being observant, asking questions, listening, being responsive to your friends who may look like they're not at their, they're acting their normal. And never keep suicidal thoughts up front when you tell you secret. then we definitely want to reach out to somebody and get some more information, resources. You know, there's a lot of support out there, crisis lines, you know, suicide hotlines. There's a lot of supports that they've got that help and connect that person to services.
Yeah, I just want to bounce off of what Paul said there. Yeah, our crisis line has been busy from day one with the pandemic and even before that, but it really picked up. We have the 24-hour crisis line, and even while the pandemic was full for us, we started to grow our services in crisis, and we went to text and chat. There's a lot more comfortable getting on that phone, typing their concerns out, or on the computer and typing their concerns out. You can get the text, the chat or text number off of our website, eastrivercenter.org. So we're also a mobile service. Like I said, in the first month of the pandemic, our mobile call-outs dropped a little bit, but after that, they bounced way back up, and we were going back out into people's homes and trying to talk to them on their porches, outside, if you want to be inside, given the pandemic. But we were out there wearing masks, doing hand sanitizer. You know, both those things very well as all of us did. But those were the new tools of our training. We were extremely mobile throughout helping with these issues. We did also see an increase in substance abuse. Those that weren't using before started experimenting with it. I'm all alone. There it is. It's right. And those folks that were suffering beforehand and struggling with their recovery found it very tempting environments to turn to those issues. And they're not able to get out to the meetings and things like that. So there again, the text and chat, those are things that can help them in that day. They can reach out to their support system through that methodology. Folks, if you see something, yeah, don't yourself. If somebody was talking about it, or even if the spidey sense is going off, like a friend I'm not sure about, feel free to call our crisis line, call any of the crisis lines to get some information, support, and guidance to help you through how to address that, because that can be very scary to hear somebody's thinking about it, and to help that person get through that. We've got a whole variety of services with each center when it comes to substance abuse as well. And we, through our wellness clinic, folks can get Narcan as well to help individuals. So, you know, resources are there. Sometimes it's difficult. When you call any of our crisis lines, folks will be glad to help anybody.
Starting to get some questions in. And so a couple of them tie in with what we're about to talk about. I just want to remind everyone, if you want to text a question, the number is 863-888-2911. So the next question, and each of you have hit on it in different ways, how the pandemic affected your ability to provide services. But can you also address how the stress of the pandemic has affected behavioral health providers themselves?
Sure. A lot of times, as therapists, we put our clients first. So we had to be mindful of taking care of our own self-care needs prior to going out into the community. It's so important. You can't give pieces of yourself if there's nothing to give. So we had to be mindful of that. And then during the pandemic, our ability to provide for our students, a lot of times we had to go through their caregivers. And so with the increased stress and anxiety, we were often finding ourselves doing, psychotherapy sessions with parents, trying to de-stress them in order to get with our students. And so the increase of telehealth was a big service our agency, like other agencies, utilized in order to complete those sessions. Some of our kids, on a positive note, we got to see those natural environments. Our young kids wanting to kick off the bed or showing us little things that little kids do that we didn't quite care about, but it was kind of quirky to see, those, hey, look what I can do. And then there was also a benefit to for our parents to see our interactions and report with some of our students. Some of our older kids, their parents was like, wow, I didn't know my child expressed that much. And so then working with our parents to teach them techniques on how to get their children to better open up to them was also one of our benefits during the pandemic. So there was some negative and some positives during our ability to provide services during the pandemic.
At the hospital, we kind of experienced the same thing. It's a busy hospital. We had a lot of COVID patients. There might have been some patients that didn't want to go seek help voluntarily because they didn't want to go into a hospital. Our unit, we did, test all of our patients so that we were always COVID negative in our unit. But we had the same issues. Staff did get sick too, so that was challenging. But we, obviously rallied together and continued to provide services because we knew that it was increasing the patients and all the stress and traumatic events from the COVID. We also, we did increase telehealth services as well for both our outpatient and inpatient. So, maybe a doctor or physician was maybe quarantined, but was okay. So he was still able to see our patients because we were able to use telehealth. In our setting, we like to promote socialization and group therapy. So it was kind of difficult when we all had a quarantine. But we made some adjustments and spread people out so that we continue our treatment, so that we can still care for our patients. But like you said, it was very challenging, but I think we overcame it and we got a lot of positive things out. Like telehealth has really helped us to be able to reach some patients and have the right staff there to help our patients. So it was good and bad.
I would agree with Alicia and Nicole that there's good and bad with the telehealth. The good side, more good than bad, because we were able to reach out to individuals that had a difficult time getting service. It would be us or other providers. They were able to get on that little box there and say, hey, we got a little window into the world, and talk to that person. And yes, it's interesting. You should bring up the point. Parents got to see their kids interacting with the therapist, hearing things that they were so expressive. It opened up some eyes on that end as well. And of course, the downside is I don't want to talk to them. It's off it went. So the control of the therapeutic environment is a little bit swelled at that point. But there could be some insight and of course, we all experience that because we're our meetings via Zoom, via Teams, via Skype, whatever your favorite software for telehealth was or meetings, right? And we're getting Zoom fatigue, right? We don't want to see ourselves in the little box anymore. So we're slowly getting back to that interactions. And quite honestly, we're hearing more and more on crisis zone that folks want to do in person. Where can I send somebody who's doing in person? And I think we're going to be moving into a way of conducting business slightly different, because the end all be all isn't just health. I think it's a good tool on top of that, because clinically, it's about the relationship between two people, having a serious discussion about serious issues that help people move forward, help us all move forward. And yeah, the struggles were there with staff being sick, staff having their own fears. We're human too, yes, right? And we're afraid that we might bring something back to our families. So again, that tool was very beneficial. So now looking at that new toy and figuring out, hey, how can we kind of use this? Still get the way we want to provide service and the way they want services.
Do any of you want to address the question about whether or not or how the pandemic affected first responders or behavioral health providers emotionally themselves and maybe ways of coping with that?
So I know at the hospital, obviously, we, experienced the frontline COVID with the increase of patients coming in. I believe that for our behavioral health staff and our, staff in the hospital, they experienced a lot of loss, a lot of patients dying, even though their heroic efforts were, given to all these patients to try to save their lives. Just the nature of the illness, it was not possible. So just that emotional drain on mental health staff and on the medical staff in general was very taxing. A lot of people didn't want to work in the field anymore. So it's been different because there has been so much death into the pandemic, really affected the hospital staff.
Thank you for sharing. There's been a lot of discussion surrounding health inequities and disparities. Alicia, can you share in your experience how the pandemic has affected that gap in access? The need for services is not only increasing because of the trauma of the pandemic, but also due to the growth that we've seen in our community. In the last 2 years, our population in Polk County has increased by almost 60,000. That's a city, that's a whole city. And so obviously that is going to cause more challenges for behavioral health providers.
So in order to dissect this question, please bear with me because there's a lot of aspects to it. So studies find that there's a large disparities in receiving mental health diagnoses across races and ethnicities. To better understand these disparities, we have to look at some statistics. Many experts say a patient is diagnosed with a disorder when they feel comfortable or able to talk with their primary care physician. Physician-patient communication differs for African Americans and whites. One study found that physicians were 23% more verbally dominant and engaged in 33% less patient-centered communication with African American patients than with white patients. African Americans often receive poorer quality of care and lack access to culturally competent care. Only 1 in 3 African Americans who need mental health actually receives it. Compared with non-Hispanic whites, African Americans with mental health illness have lower rates of any mental health service like prescriptions, medications, outpatient services, but a higher use of inpatient services. Compared with the general population, African Americans are less likely to be offered either evidence-based therapy or psychotherapy. Compared with whites with the same symptoms, African Americans are more frequently diagnosed with schizophrenia and less frequently diagnosed with mood disorders. African Americans with mental health conditions, particularly schizophrenia or bipolar disorders and other psychosis, are more likely to be incarcerated than any other race. Compared to Asian people, in particular, 7.2% and 4.7% of white patients are diagnosed with anxiety and depression, whereas Asian patients are diagnosed at rates of 2.2% and 1.5%. So we have to look at some of the barriers that African Americans face. Of course, we always have that stigma associated with mental health illness. A lot of times in the African American community, we like to keep things in-house. It's not okay to go outside of the house and talk about family business. Right? So we have that stigma, and then there's the distrust with the mental health care facility or system. If I report these symptoms, will they just lock me away? Then we have the lack of providers from diverse racial ethnic backgrounds. Often, clients like to speak to other therapists that look and feel like them. Our lack of culturally competent providers. A lot of doctors sometimes just don't understand, and that feeling is passed on to the client. And then the lack of being insured. If we don't have insurance, how are we going to go and seek help? So those barriers we're moving forward, of course, but it's still not quite enough. In the Black and Brown community, we have to be okay with having those hard conversations with each other. It's not always a kid talking back or being disrespectful if they want to break those generational curses and speak out, allowing us to express those and allowing the next generation to move on past it. And then also, it's okay to pray and be religious, but knowing when it's time to seek help from therapists.
Those are great points, and even like gave some great advice on what we can do in the community to help some of those issues. I'd like to shift a little bit to talk about specific trauma. We've gotten a couple questions, and I'm going to try to combine them all together. Are there resources available for people to help identify in friends the symptoms that come with experiencing trauma, and then what resources are available, and how can we as friends specifically help a friend or a loved one deal with the effects of trauma?
So one of the things that's key for all of us is to be curious, ask lots of questions, educate yourself. I know that I, for one, am a trained mental health first aid provider, but I can train you in mental health first aid. Mental health first aid is a training mechanism very similar to first aid and CPR on somebody choking or have a heart condition in front of you there, you leap in. With mental health first aid is the same thing. What are some of the signs and symptoms of many conditions that you can raise the question and ask what to do once you A, B, and C in place? Now what? We get a lot of training that go, here's A, B, and C. What now? That's what mental health first aid can do. The resources that we all provide through crisis lines that provides information. And by all means, access those. Ask some questions. With our crisis line, definitely my team is ready to answer some questions for you. Hey, it may not be a crisis, but it's all right. You can call us on the crisis line and say, I have a friend who may be, suffering from A, B, and C. What are some of the steps I can take? We'll guide folks through that process. And yes, we will ask about insurance because we don't want to direct you somewhere where your insurance isn't going to be accepted, because then that becomes a frustration and a barrier to even accessing services. So whether it's one of the three of us or even a private provider out there, we'll kind of help guide that person to what's most appropriate.
Yeah, so exactly what Kirk said, there's mental health first aid, there's other, online SAMHSA and other, trusted organizations that can give you kind of that guidance and advice. But I think the main thing is it's okay to talk about this. I think it's okay to, be there for a friend that maybe needs a little more care, more direction, more resources. So just being there for them, following up with them too, if you ask them how they're doing, follow up with them, ask them days later, how are you doing? They might not, answer you right away, but if they need to talk, then they'll know who to go to. They'll know that you are asking how they're doing. So just being there for everyone.
And just to bounce off of what Nicole and Kirk said, validating those feelings for our family and friends, allowing them to have that space and opportunity to know it's okay if they want to talk about those feelings, and then it's okay if they don't want to talk about those feelings, just being there for them, sometimes to just be in their presence. And then getting together with friends and family, outside of feelings. We have to spend time, together socializing and working and networking together and building. But coming together a little more often than just when something traumatic or a disaster happens.
Those are great words of wisdom. Thank you for sharing those. Let's talk next steps. So what are the steps that your organizations individually are doing to help address the access to care concerns? And then also, what would you advise us as a community? What are our next steps to help support?
At the Center for Behavioral Health, no one is denied service based on the inability to pay. So if you have a need, we have a program for you. We have open access, which is similar to our walk-in program. There's no referral or appointment needed, but I do advise you to get there early when the community does take advantage of this service. Then we also have our specialized community care team, also known as SCCT. This is specially designed to address the population that's not insured. So we have a whole program set up for those who don't have insurance to get the necessary needs that they need. And then also we have helping families succeed, and that's to assist and counsel parents in the home. So even if you don't want to come out, as we come out of the pandemic, we have services and programs that will go in home to help our clients. So we cover every mental health need of all ages. And to lighten that burden, we don't have you decide between getting that necessary help or paying bills. There's information in your grab bags on the table. There is a program if you need it. So just reach out to us and call that number, okay?
Okay, so LA Clinic Regional, we talked about the increase in telehealth, so we're doing that for both inpatient and outpatient. To reach out. We have new programs for the community, like Shop Talk, to be able to go talk to people in the community, and they would have resources for you. We also have a behavioral health social worker that's actually on the medical floor. So you might not come to the hospital for a behavioral health reason, but if the topics come up, if we're talking about anxiety, depression, substance use, we can have a behavioral health specialist to come to see you on the medical floor. We also are increasing our peer specialist program to be able to reach out to more people, and we have more providers. We're getting more and more physicians and psychiatrists, therapists in the outpatient and the inpatient to be able to serve more. And if anybody's been around Lakeland Regional and they see the big construction, we're having a new building, so we're going to be adding, we're going to have up to 96 inpatient beds. That is a need that somebody in the community has. We're also going to increase our outpatient services, TMS, ACT. We'll also be able to have more community support and events in our building, educating and providing resources to the community.
East River Center, we've got our crisis line, we've got the text and chat feature. For those of you that are here in person, some of those numbers are available in our directory you have there. For the crisis line, and the mobile team continues to come out. We've got really good partnerships with our schools, helping kind of tackle things there. When they see things happening in the school, they sometimes call us out to partner with their team, the mental health in the schools. And then we're definitely growing our partnership with Polk Sheriff's Office, where we're providing crisis counselors at each of the Sheriff's Office substations throughout the county. That is going to grow even more so because we're doing a little bit of both prevention and postvention. Some of that work they do there is after the Baker Act. We go out, and the Baker Act is the commitment law, which is at risk of harm to self or others because of their mental illness. But they come back out in the community and they need help getting connected to the services. While many of us provide that aftercare outline for them, it gets lost along the way. So we're there to kind of do a follow-up and help them so that they don't have a sheriff's deputy or a law enforcement officer on their doorstep again. We're there to try to ease some of that crisis burden in that arena. Our doors are opening up more and more so in our outpatient services, and we are extending that telehealth provision so that we start to access our services.
Just to reinforce what Kirk said, we have this great partnership with East River Center in our district offices, and we have seen significant reductions in multiple Baker Acts that our law enforcement officers are having to respond to. So we know it's working. This is just a perfect example of collaboration in our community and breaking down the silos. And so we're looking forward to taking next steps. And then as a byproduct of that, we've been very fortunate that having those professionals in the district offices, that some of our deputies have also taken advantage when they didn't feel comfortable sharing with some of the other programs that we have available for them. That just added another resource to them. So we're great to hear that. We're happy. It's great that we're hearing that as well. We do have one more question that we got that I would like for the panelists to answer. Can one of you or two of you address the role of social media when it comes to the creation of trauma and and how it is affecting the effects of trauma. Thank you, Alicia.
Yes. Of course, when we were growing up, we didn't have the social media aspect. Everything now is a filter. You have to constantly look good. You have to constantly, be at your best. So imagine those pressures put on a child while they're in their developmental years. And then with the social media aspect, it's constantly growing with I mentioned our challenges earlier. It's as if our kids are influenced to make bad decisions, more bad decisions, the more likes, right? There was a TikTok challenge of tearing up the restrooms in the bathroom at the school. And I kept asking our students, why would you tear up a restroom when you need to use it? But of course, it was a challenge. So whichever school tore up the restroom the worst got the more likes. So with social media, it's just that added constant stress that our kids can't get away from. And usually, you'll have your bully at school, and then you go home and you're able to decompress, right? But now we have our students where, it's at school, it's on social media, there's constant text, where they can't get away from it. So with the added stress of social media, it's like a constant stressor for our students. So me personally, maybe we should reduce social media, but I don't see that with the metaverse. I don't see that as our future, but our students are struggling with social media.
Can you give advice to parents who, have kids who are on social media, how they can control some of that anxiety that occurs?
I would encourage parents to maybe monitor it a little. Of course, allow them to be themselves. We don't want to have little robots walking around. But monitor it, be actively involved in your child's social media account. Know what they're posting, know who they're talking to, and be up to date on some of these trends, because some of them are outrageous. And if we as parents just are aware of some of them, we can get ahead of it. So being very active in our child's social media.
Great advice. Thank you, Alicia. Do we have time for one more question? Okay.
Jump in
Go
on
ahead.
the social media piece, because it's not just kids. It's the adults in this room. The adults out there, we have these little things that we walk around with, and we have to constantly check in. We got to check in and know what's going on with each other. We do need to shut it off. Model the behavior for our children. And yes, I agree with Alicia. We need to be screening what our kids are watching and getting into. But we've got to do it for ourselves as well. Because while it's great to have access to the information, it's also extremely stressful and anxiety producing, and it has created some issues. And we see it not only in the pandemic, but in other disasters. People were constantly watching the weather reports during the hurricanes, and the anxiety was way up there. So it's that constant barrage. You need to take a break from it. In my house, we have one night a week where we shut everything on. Read a book, not on a Kindle. I love my Kindle, but there are hardcover, real live, hard, tangible books out there.
I agree, and from personal experience, I can tell you I'm old school in some things, because I realize that I use the phone for making lists and making notes so I don't forget things, but it's also my email and my phone and other things. And I had taken a day off because I needed to accomplish something specific. And I pulled out my phone to add something to my list of things to do, and I had multiple phone calls, and I had texts that I needed to respond to, and emails. And then I realized I sat down for an hour not accomplishing what I was intending to do. So I just pulled out a notepad and I started making my lists on notepads, and I started going old school, because the phone has become more than just a phone to us. It's a computer, and it's things that we rely on. So sometimes you have to go old school to help, keep you from all of those distractions and that stress. We did have a question, and I'll try to answer it pretty quickly. The question was, how did the sheriff's office, what were the takeaways from the inmate survey that was conducted during the consultant study, and what we're doing with that information? So we learned a lot of things that were barriers to access to care. So that's part of the reason why my position was created, to help look at what we can do to help provide services to the inmates while they are in there. And those patients that are in our mental health unit, they're not going anywhere for a bit of time. What better opportunity for us to provide certain services to them? So a lot of the barriers to access to care that we found through the survey were because people couldn't get identification, legal identification. So we, unfortunately, during the pandemic, we couldn't get the bus there, but there's an ID bus that works out of Tampa or Orlando. We can ask them to come and help process them, the paperwork to get the legal IDs. I know Helping Hands, I've talked to some of those workers with the county, and they are open to helping us with some of that too. So we're identifying some of those things that are barriers that they've identified themselves as barriers that we can help them while they're in our detention facility. So we're excited about planning those things and exploring other opportunities that we can to provide better services in that. So thank you all for your participation and for being here.
Gwinnell said, thank you for your participation and being here. And I want to thank all of the panelists and Tara and Alice, also Gwinnell, Polk, Nicole, Alicia. Great information and great advice and real takeaways. And we also have a directory of services in the back for Peace River and some other material. I know Winter Haven has put out some material. So please help yourself to that if you don't already have it in your packet. Thank you again. And our next program will be May 24th, same time, same place. And the topic will be mental health in the workplace. It's going to be really, really interesting. Thank you.
See you later.